Today, we're going to talk about a drug that is frankly a paradox. On one hand, it can pull you back from the brink of a deadly infection. On the other, it could permanently damage your body. This is the story of levofloxacin, a true double-edged sword in modern medicine.
So let's set the scene. You've got a patient with a really dangerous bacterial infection. The usual go-to antibiotics, the safer ones, they're just not working. This is a critical moment, you know? And it's for this exact scenario that drugs like levofloxacin were created.
And we're not talking about your average bug here. Levofloxacin is brought in for the serious stuff, the life-threatening conditions. We're talking about deep lung infections, nasty kidney infections, chronic issues that just won't go away. These are the kinds of battles that demand a real heavy hitter.
Okay, so let's properly introduce our main character. Levofloxacin is part of a class of antibiotics called fluoroquinolones. You can kind of think of it as the special forces unit in the war against bacteria. It's broad spectrum, which means it can take out a whole wide range of bad guys, and it only gets deployed when the frontline defenses have failed.
So, how does this special forces unit actually get the job done? Well, this is where it gets really fascinating. It has this incredibly direct and destructive method. It doesn't just slow bacteria down, it actively sabotages them right at the genetic level. It's this brilliant two-pronged attack. So imagine a bacterium is trying to make a copy of its DNA so it can replicate. Levofloxacin comes in like a sabotager. First, it jams the machine that uncoils the DNA. That's an enzyme called DNA gyrase. Then it basically glues the copied pages together so they can't separate. That's another enzyme, topoisomerase IV. The result? It's catastrophic for the bacterium. Its DNA literally breaks apart, and that leads to rapid cell death. Game over.
And this is exactly why it's so incredibly potent. You see, while a lot of other antibiotics, like penicillin for example, are busy chipping away at the bacteria's outer wall, levofloxacin just bypasses all that and goes straight for the command center, the DNA. It's a completely different strategy, and it's what makes it so effective, even against bacteria that have learned to defend themselves against those other drugs.
Okay, so we know how it kills bacteria. But a weapon is only as good as its ability to reach the target, right? So let's take a look at how levofloxacin actually performs inside the human body.
What's this number? 100%. That is the bioavailability of this drug when you take it as a pill. It's just about perfect. This means a pill you swallow is basically just as effective as getting the drug through an IV drip. That is a massive advantage in the real world. It means patients can get out of the hospital sooner and continue their treatment just as effectively at home. It's a huge deal.
And it doesn't just get into your blood, oh no, it gets everywhere. Its ability to get deep into tissues, we're talking lungs, sinuses, the prostate, is precisely why it's used for those really tough to treat infections we talked about earlier. It goes straight to the source. And on top of all that, it's got a long half-life. It stays active in your system for 6 to 8 hours. For the patient, that just means simple, once-a-day dosing, which makes it way easier to actually stick to the treatment plan. I mean, so far, this thing sounds like the perfect weapon, doesn't it?
Well, this is where our story takes a very serious turn. The incredible power that makes levofloxacin so effective comes with a hidden cost, a risk so significant that it carries the FDA's most serious alert, what's known as a black box warning.
This is a direct quote from that warning, and it's pretty chilling. The drug can cause painful inflammation of your tendons and can even cause them to rupture completely. The one that gets hit most often is the Achilles tendon right in your heel. And this can happen while you're taking the drug or even months after you've stopped. And it doesn't stop there. The black box warning also covers potentially permanent nerve damage, serious effects on your brain like seizures and confusion, and a really dangerous worsening of a muscle weakness disease called myasthenia gravis. Let's be clear, these aren't minor side effects. They can be absolutely life-altering.
Now, this risk isn't the same for everybody. It's much, much higher for older folks, people over 60, and for patients who are also taking steroid medications, or for people who've had an organ transplant. This is absolutely crucial information for any doctor who's even thinking about prescribing this. And beyond those black box warnings, there's a pretty significant risk to the heart. Levofloxacin can actually mess with the heart's electrical rhythm. It's something called QT prolongation, and that can lead to a potentially fatal arrhythmia. It's especially dangerous for anyone who already has a heart condition. And finally, this drug really doesn't play well with others. Just look at this table. Simple things like antacids or vitamins with iron or calcium can basically stop the drug from working at all.
Take it with steroids, and that risk of tendon rupture we talked about goes way up. Mix it with a blood thinner like warfarin, and your bleeding risk increases. Even taking it with common painkillers like ibuprofen could raise your risk of a seizure.
So, we've seen both sides of the coin. On one side, you have an unbelievably effective bacterial saboteur, and on the other, a terrifying list of potentially devastating side effects. So how on earth do doctors and patients make this call?
Well, there's one more huge factor we have to throw into the mix: antibiotic resistance. The more we use these super powerful antibiotics, the more chances we give bacteria to evolve and figure out how to beat them. So using a drug this strong for a minor infection isn't just a risk for that one patient. It's a risk to all of us and our future ability to fight infections.
And that brings us to the crucial point, the main takeaway here. Levofloxacin is a reserve drug. It is a tool that is kept in the toolbox for specific, dangerous situations where the threat of the infection is far greater than the threat of the cure. This is not for a sinus infection that might clear up on its own. It's for the pneumonia that could actually kill you.
So, to wrap it all up, what have we learned? Levofloxacin is an incredibly powerful weapon, a true DNA saboteur that's extremely effective when it really counts. But that power comes at a steep price, with black box warnings for severe, sometimes permanent side effects. It really forces this high-stakes balancing act between profound benefit and profound risk. And that really leaves us with one final big question to think about. The story of levofloxacin isn't just about one antibiotic. It's a perfect case study of a central challenge in all of modern medicine. How do we, as patients, as doctors, as a society, weigh a treatment's incredible power to heal against its very real potential to do harm?